Hello and welcome to Crack the Board. In today's video, we will focus on USMLE questions related to pathology. Let's have a look at the first question. A 31-year-old woman presents to the physician's office with complaints of fatigue and joint pain. On physical examination, she has wrist deformities and ulnar deviation. Laboratory tests show hemoglobin level of 8, hematocrit of 29%, and a white blood cell count of 8,500. A peripheral blood smear is reviewed. Considering the morphology of the red blood cells, what is the most likely underlying cause of the hematologic abnormalities? A. Autoantibodies to red blood cells. B. B12 deficiency. C. Chronic disease. D. Folate deficiency. E. Iron deficiency. The correct answer is C. Chronic disease. Based on the blood smear provided in the image shown, the RBCs are normocytic and normochromic. The anemia of chronic disease is of the normocytic and normochromic type. There is a quantitative reduction of the RBCs produced, but they are qualitatively normal. And the anemia in this patient is most likely secondary to rheumatoid arthritis based on the complaint which she had of the joint pain, and on the physical examination she had wrist deformity and ulnar deviation. Let's have a look at why the other options are incorrect. Option A, autoantibodies to red blood cells, is incorrect, as the peripheral blood smear would have shown many reticulocytes appearing as polychromatic. There would also be many spherocytes because of bits of cell membrane of damaged red blood cells which are removed by the spleen. Option B is incorrect, as in vitamin B12 deficiency there will be a megaloblastic anemia which would have produced macrocytes and hypersegmented polymorphonuclear cells. This goes the same with option D, as in folate deficiency also the anemia is megaloblastic and there is production of macrocytes with hypersegmented polymorphonuclear cells seen on the peripheral blood smear. And option E is incorrect, because if it would be iron deficiency anemia, then the microcytes would appear hypochromic, and in this blood film there is no hypochromia seen. Let's have a look at the second question. A 54-year-old woman is referred to a neurologist by her primary care physician due to a pronounced intention tremor and slurred speech. Which area is most likely affected on her head MRI? A. Arcuate fasciculus. B. Nigrostriatal tract. C. Nigrothalamic tract. D. Superior cerebellar peduncle. E. Vestibulospinal tract. The correct answer is D. Superior cerebellar peduncle. The superior cerebellar peduncle contains all of the cerebellar efferents which project to motor nuclei in the brainstem and thalamus. The cerebellum coordinates voluntary movement. Therefore, damage to the cerebellar peduncle may cause an intention tremor, as seen in this patient. It would also explain the patient's dysarthria and the speech difficulties. Let's have a look at why the other options are incorrect. Option A, arcuate fasciculus, is incorrect as the arcuate fasciculus connects the Broca's area with the Wernicke's area in the cerebral cortex. It coordinates the production and interpretation of speech, and a lesion to this structure would not present with a marked intention tremor as seen in this patient. Option B is incorrect as a lesion in the nigrostriatal tract results in signs of Parkinson's disease, including a resting tremor, microphonia, micrographia, and a shuffling gait. None of these signs are reported in this patient. Option C is incorrect as the nigrothalamic tract connects the substantia nigra with the ventrolateral nucleus of the thalamus. Damage to this tract removes the inhibitory control over the ventrolateral nucleus, and loss of nigrothalamic control may result in a resting tremor, not an intention tremor, which is mentioned in this question. Option E is incorrect as the vestibulospinal tract includes the vestibular fibers carrying information to the spinal cord. Damage to the vestibulospinal fibers would interfere with the patient's sense of balance. However, it would not cause the intention tremor or slurred speech as reported in this patient. Let's have a look at the third question. A 28-year-old laborer living in a camp visits his primary care provider due to a solitary, painless swelling on his neck, present for 6 weeks. Examination reveals an enlarged cervical lymph node, which is biopsied and analyzed. Zell-Nielsen staining identifies red beaded bacilli. What other histopathologic findings are most likely present in the biopsy? A. Caseous necrosis. B. Giant cells. C. Monocytes. D. Non-caseating granulomas. E. Rim of peripheral lymphocytes. The correct answer is A. Caseous necrosis. From the question itself, the history, the examination, and the finding on the staining points towards tuberculosis. And the patient has findings consistent with scrofula, which is a tuberculosis lymphadenitis. Caseation is typical for a tuberculous granulomatous reaction. Usually these granulomas show central caseation. Let's have a look at why the other options are incorrect. Option B is incorrect as giant cells result from fusion of macrophages and are seen in several granulomatous and non-granulomatous conditions. Giant cells also form from the fusion of virally infected cells, such as in patients with varicella. Option C is incorrect as monocytes are cells of the innate immune system that are not limited in function to granulomas. Option D is incorrect as Non-caseating granulomas are usually seen in conditions such as berylliosis and sarcoidosis. Option E is incorrect, as all chronic inflammatory reactions involve cells of the adaptive immune system, and the presence of lymphocytes is not a definitive characteristic of a tuberculous infection. This concludes today's set of questions. Thank you for watching. If you enjoyed it, please don't forget to subscribe to the channel to stay updated on our latest content and support our journey.